Well, we got involved with the Home from Hospital service in Ayrshire because our strategy is about refusing to ignore people in crisis. And we got similar services in other parts of the country. So we had a feeling that it could work, and it could work well within Ayrshire. So we had contacted the Health and Social Care Partnerships and said, we think we've got a project here that might help with some of the issues around saving bed days and reducing admissions.
We thought there was a really good opportunity to go up and to support A&E staff and to support people to come back home, because sometimes A&E, hospital staff, A&E staff don't know what the person's circumstance is at home.
Patients would stay in hospital overnight until they could get a resource to take them home, which obviously makes it more patients at risk for a hospital-acquired infection because they're staying in hospital for extra nights. It has a negative impact on flow from A&E up through to the wards.
So we transport them home, and then when we get them home, we do what we call some resettling work with them. Now that can be as simple as a quick safety check of their home. So are their doors secure, are windows secure? We look for things like trip hazards within their own home. We may do a little look at some of the electrical equipment to make sure that looks safe. But we're also able to connect people into friends and family, make sure that people know that they're home. Sometimes we might need to link in with their carers, make sure that the care organisation knows that they're home. And occasionally we might need to link in with some of the out-of-hours services, and we have a very good relationship with the Ayrshire out-of-hours service.
In terms of the difference it's made, people spend more time in their own home, and we know that most of the population want to be at home. They don't want to be in hospital. So as part of the partnership work with the Red Cross, they carried out an evaluation after 12 months, and they asked the people that they had transported and settled back at home questions against the 9 national health and wellbeing outcomes.
We have interviewed some service users and tried to understand how they perceived the service and how beneficial it was for them. And I think what we're hearing back from them is that they are very appreciative of that service. And I think for a lot of them, having that person that's there, having that person in their corner has made that huge difference.
Basically it was like, for me, for being on my own, to suddenly somebody being there and listening to what I had to say was a great relief. It took a lot of stress and worry that I had on my shoulders off, because there was somebody there that understood what I was talking about.
Well, my hopes for the future is that we continue to work in partnership, because we haven't commissioned the Red Cross in a traditional way. We've worked with our third sector interface, and they have commissioned the service on our behalf. So it's a real partnership approach, and I think it's a blueprint in terms of the way we should be working with other third sector and independent sector organisations. It's really been a fantastic piece of work that people appreciate, that people are getting the value out of. So I look forward to continued relationships with the Red Cross.